Are you ready to start creating solutions in healthcare? Hi, I'm Dan Kendall, the founder of Health Podcast Network, and I want to let you know about a podcast I think you'll love. It's called Nurse Rosa's Insights, and it's hosted by Rosa Hart. Rosa interviews healthcare leaders and innovators to uncover the challenges they face in their specialties and the creative solutions they're bringing to the table. With her background as a neuro-ICU nurse, stroke nurse navigator, and award-winning podcaster, Rosa brings a unique perspective and passion for elevating care for both nurses and patients. Listen and follow Nurse Rosa's Insights on your favorite podcast app, and you can find all the links you need at healthpodcastnetwork.com/Rosa. That's healthpodcastnetwork.com/Rosa.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. So imagine this, bass pumping through massive speakers, LED screens stretching toward the ceiling, and Lenny Kravitz taking the same stage, where Dr. Jill Biden would later address thousands of people. This is the HELTH Conference, HLTH, a 4-day conference that brings together leaders from all over the nation. Imagine now Silicon Valley meets healthcare in what's supposed to be a display of innovation and possibility. That was the goal of the conference. There's lots and lots of articles and videos and audio released during the conference and right after about the glimmer and what's new, what's trending, you name it. As always, I'm hoping to do something a little different with this series for this podcast. While most attendees were focused on the next breakthrough app or groundbreaking partnership to get their company off the ground, I was there asking a different question. In all this disruption and innovation, where does health equity fit in? And as part of the Health Podcast Network, I had the unique opportunity to sit down with 5 leaders on how they are tackling healthcare inequity from different angles. From thinking differently about geriatric care to solving the mundane and critical problem of fax machines. Yep. Just think about fax machines and how that's related to equity. You might not know yet. That's why you need to listen to these episodes. And over these 5 episodes, which are going to be shorter than our usual long-form episodes at about 10 minutes each, you'll hear from Maria Carney at the Northwell Health team, who are fighting against age discrimination in healthcare and what it means to care for our aging population. And from the same system, because they're doing remarkable work, you'll hear from Sven Gerlinger, who's reimagining patient experience and talks about what equity means to him. Then you'll hear from Dr. Avantika Waring, it's a familiar name, she's been in the podcast before, about innovation in cardiometabolic care and what that means in the context of health equity. Then Bevy Miner, who's tackling the tech inequity in healthcare communication. And lastly, Brad Williams, about making nutritious meals accessible. So the key question is, how can we make healthcare work better for everyone, not just the privileged few? And the goal is, if you're a clinical leader, expand your lens on where all health equity fits in. And if you're a clinician, think of where you need to advocate to make systems better. So for the first episode, Dr. Maria Carney is going to dive deep into their groundbreaking work in geriatric care. It's a story about fighting systemic ageism in healthcare, which might surprise you and will definitely inspire you. Here's Maria Carney.
Maria, it's so great to have you here.
Thanks for having me.
Tell me a little bit about yourself.
I'm a physician, an internist, geriatrician, and palliative medicine physician at Northwell Health. My role there is Chief of Geriatrics and Palliative Medicine and Medical Director for Continuing Care.
Yeah, we have a workforce shortage, but you're the most coveted physician as the population ages. Just everything that you said is the expertise that we need.
Thank you.
Tell me now, you did a panel on social health. So what does social health mean to you?
Social health means care, and healthcare plays a role in that area. But right now, if you have care needs, if you have what we call activities of daily living difficulties, grooming, bathing, toileting, or independent activities of daily living, shopping, making appointments, entering into your community. You need care. And social care helps you to be independent and live in your own home. If it's not there, then you fail in the community and you're at risk of being hospitalized and utilizing healthcare to help support your needs.
You had some great statistics about how important this is going to be. Tell us about how the population's aging and what you know about it so far.
Well, the positive is we are all living longer. We are able to manage diseases like we've never been able to manage disease in the past. So we are living longer, productive lives. An unintended consequence of that is that the over 65 population is growing. And for the first time within the next 10 years, by 2034, the over 65 population is going to outnumber the under 18 years of age population. This has never been in the past. This is the first time in the history of the United States that the over 65 population will outnumber the under 18.
Yeah. And we need to prepare and maybe start changing things right now. I think it's an urgent and important problem to address.
What that means is, because as we get older, we start accumulating illnesses or diseases, often managing them quite well, maintaining your independence. But it can get to a tipping point where caring for one disease affects or impacts another one negatively. And sometimes individuals and families have to make shared decisions about what is your priority, what's most important. Is it to be pain-free? But if that comes at being confused or clouded, what's most important? That's just one example.
And I find it's even more important for populations who don't speak English, immigrants, refugees, people of color, of having multi-generational households. We know statistically just people in those communities have multi-generational households. So often they're in a caregiving role. Tell me what we know about that and how this is especially relevant for those communities.
I know this from a medical perspective and the literature, but I also know this personally. I'm a first-generation American. My parents came from Cuba. I'm the youngest of four. And my grandfather grew up living in our home. And as the youngest of four, I would always accompany my mother to doctor's appointments, or I would be asked to go for a walk with my grandfather or help him with certain things. He had a stroke and then came home. So yes, the literature supports this, that minority populations, immigrant populations have multi-generational homes, and there are often multiple caregivers, family caregivers, attending to a loved one. So what does that mean? If you go to a doctor or 5 doctors and they tell you instructions to follow, how do you communicate to all the different family caregivers involved? And there may be a loss in translation. You say it to one adult child, they may tell it to their child to help. So the instructions may get lost. And that impacts healthcare. And that may cause complications, not meaning to. You're just trying to do the best you can, and it's hard.
Yeah. The other aspect that you share that really resonated with me is that it's not all negative aging. It often feels like we default to aging means there's going to be more problems. You can age with dignity, and there's some pride in aging. And I think that's foreign lens to maybe our society. Tell me what you were thinking when you mentioned that aspect.
The over 65 demographic is an incredibly diverse demographic. You could be 90, independent, running marathons, productive, contributing vitally to the lives of people around you and to society. You could maybe be 60 with multiple medical problems that's struggling. So it's a diverse population. We shouldn't be ageist. It's not negative. These are really incredible times where people are living longer. We potentially can live to 120. We have more centenarians alive today than ever before. So this is a positive thing. We should be celebrating it. But then there are really healthcare system changes we have to make which means how do we care for individuals with multiple medical problems in the best way possible?
Yeah, I agree with 100% of what you said. What has that look like in this journey for you? Being in your system, trying to get people educated about it, as well as fix the systems to care for these aging population. What have you found is effective?
I'm very fortunate that at Northwell Health, our CEO, Michael Dowling, has embraced longevity, aging, and caring for individuals and their families, whoever your family is. And he has a phrase, he says, providing the right care at the right time and in the right place, right? So we have to figure out needs. And it's a challenge because healthcare has become cookie cutter medicine. You try to, for efficiency purposes, throughput purposes, really just try to find the simplest, efficient process. But as we get older and we become complex, this population is diverse, cookie cutter medicine just doesn't work. And their resources and their support varies. So what works is having a buy-in of leadership at the corporate level and showing that if we impact and focus on the care plan, making the right care plan, having conversations, goals of care to make the right care plan, we are showing impact on readmissions, length of stay, patient experience, all of these quality metrics that are important to not only the business, but also to patients.
Yeah, I can totally see that. How have patients communicated how they felt once they're being taken care of in a different way? Because you're still practicing.
Yeah.
So you're seeing the system change. And I'm imagining patients go through the system in a different way. How has that been for you?
We're focusing on what matters most to individuals when you have multiple chronic conditions and you're trying to figure out what to prioritize because it's hard to do everything. When you ask that question, what's most important to the person? Their eyes open and they feel heard and they're able to communicate. And we try to make a care plan that works for them. And we're trying to teach this across our health system. So the workforce has to change. We have to have the skill set. And we really believe in the age-friendly health system initiative to bring all healthcare workers, the workforce skilled to care for people with multiple chronic conditions.
Yeah, that's amazing. How have you navigated the difficulty in communication with people with limited English proficiency when you're doing this work? Because I feel like there's dementia care and that can take a while to talk about what it means, walk through the roadmap and help people feel cared for. And you add on an interpreter on top of that. There just tends to be a lot more miscommunication. Not sure if you've noticed it or what you think we could be doing differently.
That is an incredible question. The translator services are effective in communicating clearly what is being said, but sometimes that compassionate tone is lost. And I don't know how we can embrace that to where we can capture the expression of empathy or support or understanding. And maybe there's a role with technology to help in that aspect, where we're not so exact in translation, but we're able to guide some compassionate conversations.
At least acknowledging it's a problem, because I don't feel many people notice it, of what the patient actually hears when there's another person in the conversation, like an interpreter, and that can vary so much and affect how people feel cared for as they're aging. Tell us about your book.
Thank you. So the book is co-authored Michael Dowling, Charles Carney, and myself. It's entitled The Aging Revolution, and it really talks about the workforce and healthcare systems, how we've been caring for older adults historically, and the incredible heroes that we interviewed. We interviewed hundreds of people to get the story right, and the direction we're going or need to go in the future. So it starts with Dr. Robert Butler, who is the founding director of the National Institutes of Aging, an incredible gentleman who was my chairman during my fellowship at Mount Sinai. It talks about the age-friendly health system. Another chapter is about family caregivers, the invisible workforce that they are for healthcare. And then it starts going into payment models, Medicare Advantage. And then we talk about what's needed in the future, addressing behavioral health, primary care. So there are a lot of books out there about what you and I can do to age well individually, but there's not a book out there that talks about healthcare systems and the progress we've made and where we need to go. It also talks about the rise of palliative medicine, where that came from. So it may help understand where we are today. And two fields, geriatrics, palliative medicine, are really in its infancy. So better understand why they came about and where we need to go. So I really hope people will read it, not only in healthcare, but all individuals, so they better understand healthcare and how it plays a role in their longevity.
Yeah, I'm excited to read it. I feel like I'm always looking for books, and it seems like such a great resource. And you did your due diligence of interviewing hundreds of people, so we know we have multiple perspectives. Any other call to action for our listeners?
Call to action is watch Medicare. Watch what the Centers for Medicare and Medicaid Services, our government, it is an important payer. It is the largest payer out there for those over 65 and some younger. It's influential, it's vital, and there's been a lot of changes over the last few years that have rapidly changed Medicare. We're seeing Medicare Advantage. There's more changes coming. I would say be educated, be empowered to learn more about Medicare and how we should protect it.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have two quick requests. One, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. Two, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.